I'm John Giever with MedPage Today in Paris for the Alzheimer's Association International Conference on Alzheimer's Disease. A number of lifestyle factors have been linked with Alzheimer's disease, and the question is raised as to what would happen at the population level if these were reduced significantly. Two researchers at the University of California, San Francisco, Drs. Deborah Barnes and Christine Yaffe, have taken a first stab at answering this question. Dr. Barnes spoke at a press briefing here.
There are many potentially modifiable risk factors that have been identified, but we don't really know which should be targeted. And so specifically, we don't know what would happen if we could change these risk factors at a societal level. How would that impact disease prevalence over time?
The researchers focused on 7 factors: obesity, smoking, diabetes, hypertension, depression, low education, and physical inactivity. It turned out that the relative risks associated with these factors were quite modest, and that it was the prevalence that really mattered. So in the United States, physical inactivity accounted for 21% of Alzheimer's cases in their analysis. Depression was next most important on the list, responsible for 15% of cases.
So the implications are that up to half of Alzheimer's cases may be attributable to these potentially modifiable risk factors. And I think this is actually really exciting because it suggests that public health interventions to increase education and physical activity and reduce smoking rates and depression could potentially have a really dramatic impact on Alzheimer's disease prevalence over time. So I feel like it gives us a little bit of hope about things that we might be able to do now to try to prevent the epidemic that we see coming our way. I think it's important to note that these are models. These are, estimates of what would happen if we could change these risk factors based on the available data. What we really need now are intervention studies to test what the impact of prevention strategies would be.
In Paris, I'm John Giever, MedPage Today.